Hi everyone, I'm Dr. Fred Bloem. I want to tell you about a patient who came to me recently with a very painful problem, a severe sore throat, relentless coughing, chest tightness, and fatigue that just wouldn't go away. For days he struggled with a burning throat, a deep hacking cough, and this awful pressure in his chest and head. He tried everything he knew: ozone insufflations, PEMF, supplements, and while these gave him brief relief, the symptoms kept coming back stronger every evening. Now, many doctors would have written a prescription for antibiotics right away, but here's the thing: not every cough, sore throat, or chest infection needs antibiotics. In fact, overusing antibiotics can do more harm than good. That's where I take a different approach. Instead of jumping to pharmaceuticals, I always ask, what is the safest, most effective way we can help the body heal itself? And in this patient's case, the answer was neural therapy, a powerful yet underutilized technique that resets the body's own regulation systems. Neural therapy uses gentle injections of procaine, a local anesthetic, into specific points like scars, nerve ganglia, or muscles. This resets interference fields in the nervous system, areas that are stuck, sending the wrong signals, keeping the body locked in cycles of pain, inflammation, or illness. One of the most effective applications of neural therapy is something called Infraspinatus respiratory response therapy, or IRR. When the infraspinatus muscle is in spasm, it can trigger bronchial spasms, coughing, chest tightness, and even shortness of breath. By treating this muscle, we can relieve that nervous system overload and help the lungs relax. For this patient, I didn't stop at the infraspinatus. As part of IRR therapy, I also injected specific points on the sternum, areas directly connected with the lungs and respiratory system. This combination helped calm the nervous system signals from both the shoulder and the chest. And what happened next was remarkable. He sat up, took a deep breath, and said, "Wow, I feel like my chest is opening up. That pressure in my head is gone. For the first time in days, I can breathe again." You could see the relief on his face. It wasn't just physical, it was emotional. The weight of struggling to breathe had finally lifted. This is what I love about integrative medicine. It allows me to combine the best of safe, innovative therapies like ozone, herbs, and neural therapy while using pharmaceuticals only when absolutely necessary. It's not about rejecting conventional medicine. It's about using it wisely. And sometimes the safest and most effective treatment is not a pill at all, but helping the body reset itself. So if you're dealing with chronic throat issues, coughs that won't go away, or unexplained chest tightness, remember, antibiotics aren't always the answer. There are safer, smarter, and more effective ways to heal. I'd love to hear from you. Have you ever had a cough or sore throat that didn't respond to antibiotics? Do you think approaches like neural therapy should be more widely available? What natural remedies have helped you the most when you were sick? Share your thoughts in the comments below. I read them all and love hearing your stories. If you found this helpful, hit the like button, share it with someone who struggles with recurring coughs or respiratory issues, and don't forget to subscribe for more real patient stories and insights into integrative medicine.